Now I will be discussing a case of a 31-year-old boy. He was a very promising cricketer and son of a very famous cricketer, and this case was very close to my heart. A very good morning to all of you. It is very unfortunate that we are getting a lot of corrective hair transplants. Almost every day we are getting one or two patients who are correcting their previously bad hair transplants. Now I will be discussing a case of a 31-year-old boy who had got a hair transplantation some 10 years back. It was very impulsive. He got the hairline fixed and it was very bizarre, and he got to know soon after his transplantation the hairline was from left to right very obliquely placed, and the most unfortunate part was all the hair they are growing backward. Anatomically all the hair they fall forward, and after they have attained certain length you can put it in any direction. In this case all the hair were going backward. So with passing of time, he started to know that it has all gone wrong. He started becoming very conscious about that, and that was hit his career. He was a very promising cricketer and son of a very famous cricketer. He was ex-cricket captain of India, Mohammad Azharuddin's son. So that was gone into his heart and mind, and he did not concentrate on his sport. So 10 years passed. Can you believe that he was every day, whenever he used to look into the mirror, he was stressed. He was feeling so sad and so bad about it. And he realized that probably it is never going to be corrected, or he has to live with that. And his father, who was also balding, and when he saw that his son's hair was bad and son has got affected with that, then he also decided not to go for it. And he actually kind of felt that the technology, the science is not good. It was bad for hair transplantation. When his father got kind of convinced that he should get a hair transplantation done, he saw our work on the scalps of a lot of his friends. During the day of the procedure of his father, this boy visited us just to be with his father. After the first day of the procedure of his father, this boy developed the confidence that we can fix his issue. So then so we decided that we'll go ahead. It was so bizarre that I took 2 to 3 days to comprehend and imagine how to go ahead with him. Close to 1200 grafts were extracted on the frontal part, which were very bad. And we tried to conserve as much as possible the spots at which the bad were there. So we had to create new tunnels there so that you can use those openings, or you can use those cuts on the skin, so that we are not making many slits, or we are not creating many scars on the frontal part. It was very difficult to imagine. It was very difficult for me to do that also. And somehow we used all those spots, and we put the hair facing forward close to 15 to 20 degrees to the skin, and right angle and right direction, and of course the right kind of curl. So close to 3000 odd grafts more was taken from his back to fill the mid and the crown skull, and he was balding, it was big time he was balding. His donor was extremely bizarrely extracted. The certain patches where it was too much of hair was taken out, and that was looking very bad, and he could not keep short hair, and he knew that it is looking very bad from behind. So what we did was evenly extracted hair from rest of the skull of the donor area, and took close to 700 grafts from the beard and fixed the bad donor. So all the scars were filled with his beard grafts, and in that way we could do the overall job. So the hairline hair were extracted, new hair were placed in the right angle, right direction, and right in the shape of the hairline. Then mid and crown was filled with scalp hair, a little bit of beard hair, and beard hair were taken, and we fixed the bad donor. And once this was done, soon after the procedure, and the boy was elated with so much of joy. The hair has not grown yet, but he could see the shape, he could see the overall thing that has come up, and he's in touch with us. And I will also show you the pictures after 15 days, after 20 days, and after 1 month when the ugly duckling phase has come. Definitely we are going to share the final outcome. but this case was very, very close to my heart. So it took me some, overall 1 week to comprehend, to imagine, to do the procedure, which I took like almost 3 days. Extremely kind of, demanding and consuming, but very, very gratifying. I felt that, all those, kind of 10 years that I've spent in this field kind of helped me to do repair of this case. And I'll keep you posted about the update. Thank you.